Jessica. All right, I'd like to thank the organizers and Dr. Miller for inviting me and organizing this session today. My presentation is on donor-derived anti-CD19 chimeric-antigen-receptor-expressing T cells for treatment of malignancy persisting after allogeneic transplant. First of all, what is an anti-CD19 chimeric antigen receptor? You can see that a chimeric antigen receptor, or CAR as we call them, is a fusion protein that encodes an antigen recognition domain and T cell activation domains. This fusion protein is encoded by DNA that is put into a viral vector, which is used to modify T cells. You can see on the bottom, the T cell then expresses the CAR on the cell surface, and this gives the T cell the ability to attack a tumor cell expressing CD19. So as far as transplant and the use of anti-CD19 chimeric antigen receptors, relapse of malignancy is a leading cause of death in patients undergoing allogeneic stem cell transplantation. B-cell malignancies persisting despite allogeneic stem cell transplantation are often treated with unmanipulated donor lymphocyte infusions. Donor lymphocyte infusions have inconsistent efficacy and are associated with significant morbidity and mortality from graft-versus-host disease. We aim to improve the treatment of B-cell malignancies post-transplant by infusing allogeneic T cells genetically modified to express an anti-CD19 chimeric antigen receptor. This is the design of our trial. Patients with any CD19 positive B-cell malignancy persisting after transplant and at least one standard DLI are potentially eligible. Patients must have minimal or no GVHD and must not be receiving systemic immunosuppressive drugs. Patients receive a single infusion of anti-CD19 CAR transduced T cells without any other interventions. So no chemotherapy is given to these patients. The trial consists of a single infusion of cells, so there's no confounding factor of chemotherapy. The CAR transduced T cells are derived from the original transplant donor. So we have to ask the sibling donor to come back and donate again, or we obtain cells through the National Marrow Donor Program. This is a phase 1 dose escalation. 10 patients have been treated. 3 patients obtained substantial regressions of their malignancy. A patient with CLL obtained a complete remission that is ongoing after 12 months. Another patient with CLL had tumor lysis syndrome as his CLL regressed in bone marrow, blood, and lymph nodes. This patient unfortunately then developed progressive CLL approximately 2 months later. But due to his huge disease burden and his impressive response, it was still an interesting scientific and clinical finding. A third patient with mantle cell lymphoma obtained a partial remission. Toxicity was manageable and consisted of fever, hypotension, and B-cell depletion. I want to highlight one patient just to show how heavily pretreated these patients are. We have to understand these patients have all been heavily pretreated, then they had an allo transplant, then they had a standard DLI, at least one. They all actually had more than that before coming to the trial. So this patient was diagnosed with CLL in 1996, had multiple lines of chemotherapy, 2 matched sibling transplants, then an unrelated donor transplant in 2009, multiple lines of chemotherapy post-transplant, and 5 unrelated donor lymphocyte infusions. She then came to us. We gave her 1 infusion of T cells, 1 times 10 to the 6 CAR positive not 1 times 10 to the 6 total T cells per kilogram. Before treatment, you can see this large abdominal mass. 1 month after treatment, it had shrunken significantly. And then 9 months after, it's approximately less than 1 centimeter, so it's a complete remission by the CLL standard staging criteria. This patient remains in complete remission 12 months after treatment, healthy and without any problems. So in summary, allogeneic anti-CD19 CAR T cells have significant anti-malignancy activity when administered without prior chemotherapy. Allogeneic T cells expressing a CAR caused regression of malignancy in patients who were not lymphocyte depleted. Malignancies that were resistant to standard donor lymphocyte infusions regressed after administration of allogeneic anti-CD19 CAR T cells. No patient developed GVHD on this trial. So we did not see any GVHD in any of these patients, and there is significant patient-to-patient variation in efficacy and toxicity. Obviously, we need to improve because we've only obtained regressions in 3 out of 10 patients. But in this heavily pretreated group, it is scientifically interesting and promising for future development. Thanks.